Osteomyelitis is the inflammation or swelling which occurs in the bone, and it can be resulted from an infection distant to the bone, or it can be started in the bone itself, often as a result of an injury. Osteomyelitis is more common in younger children, but it can happen at any age. So first, let's quickly recap about the bone anatomy. This is a long bone and it has two main regions, the diaphysis and the epiphysis. And in between that, we can find the metaphysis. The diaphysis is this hollow tubular shaft which runs between the proximal and the distal ends of the bone. And inside the diaphysis, we can find the medullary cavity which is filled with the bone marrow. The epiphysis is filled with spongy bone, and each of these epiphyses will meet the diaphysis in here, and that is the metaphysis. During growth, the metaphysis contains the epiphyseal plate, and this is the site of long bone elongation. When the bone stops growing in early adulthood, approximately at 21 years, the epiphyseal plate will become the epiphyseal line. So in osteomyelitis, there's an infection or an inflammation in the marrow and bone, and it's most commonly caused by a bacteria. In children, this is seen as a transient bacteremia which will seed to the metaphysis, and in adults, it's commonly due to an open wound which seeds to the epiphysis. So now let's talk about the causes. The most common cause is Staph aureus. Neisseria gonorrhea can do it, especially in sexually active young adults. Salmonella is the most common cause in patients with sickle cell disease. Pseudomonas is an important cause, especially in IV drug users and diabetic patients. Pasteurella is an important cause, especially in patients that has been exposed to a dog or cat bite because it can cause osteomyelitis. Another important causative agent is Mycobacterium tuberculosis, and when TB involves the bone, it classically involves the lumbar vertebra, and that is what we call as Pott's disease. So how do they present? The clinical features of osteomyelitis are bone pain with fever and leukocytosis. There are two types of osteomyelitis, acute osteomyelitis and chronic osteomyelitis, and they can be differentiated by their clinical features and the patient profile. In acute osteomyelitis, it usually occurs in children and they'll have a recent history of an infection like a septic toe, boil, or a sore throat. And they'll complain of a severe bone pain, and because of that, they won't really move their limbs and they are unable to bear weight. They'll also present with systemic symptoms of infection like fever with chills and rigors and malaise. In chronic osteomyelitis, it's usually common in adults with a history of compound fractures, and they'll complain of a previous acute infection which is unresponsive to treatment or relapsing even after a treatment. You might also find a non-healing ulcer or a draining sinus tract on examination, and in here the bone pain would be more generalized, and they'll also have a chronic fatigue and generalized malaise. So how do we investigate this condition? We can do hematological and radiological investigations to confirm the diagnosis. We can do a full blood count, ESR and CRP levels, where you'll see the high WBC count, high ESR and high CRP. However, in chronic osteomyelitis, this ESR can be high or normal. We can also do a blood culture to check what kind of an organism this is. For radiological investigations, you can do X-rays, ultrasounds, MRI, and bone scan. X-ray of the bone is not really useful until 10 to 14 days in acute osteomyelitis, but we can use this as a baseline investigation. In chronic osteomyelitis, you can find sclerosis, cyst formation, sequestrum, and involucrum on an X-ray. The treatment of osteomyelitis is with intravenous antibiotics. The choice of antibiotic is determined by the causative agent, and that's why we have to do a blood culture and antibiotic sensitivity test prior to the treatment. These patients are in great pain, so analgesic is a must, and the affected part should be well rested. Surgical drainage and removal of the dead bone or the sequestrum is necessary, and even after removing that area, we have to manage the dead space by inserting antibiotic impregnated beads until the infection is settled. And once the infection is settled, a bone graft can be done. Delayed treatment can lead to chronic osteomyelitis. And that's all about osteomyelitis. You can support my channel by simply clicking the like button, commenting and subscribing. I'll see you again next week with another interesting topic just like this. Until then, goodbye.